Hello, everyone. My name is Rashelle Hoffman, and I'm a physical therapist as well as a postdoctoral fellow at the Rocky Mountain Regional VA and the University of Colorado. And the abstract I'll be presenting to you today is entitled Turning Spatial-Temporal Metrics and Strategies with End-Stage Hip Osteoarthritis. I do want to disclose that all the views presented are mine and the co-authors today. And so this abstract focuses on evaluating turns. So why are turns important? Well, as many as 50% of our steps taken during daily activities are turning steps. So if you think about preparing a meal in your kitchen, a lot of those steps are turning, involving going to the fridge, countertop, sink, whatever you need to prepare that meal. Additionally, there seems to be a link in older adults between poor turn performance and increased fall risk. For older adults with end-stage hip OA, turn performance is often poor, which has been attributed to pain that impacts limb use. However, we do not know if turning patterns are related to fall risk or balance performance in older adults with hip OA, and being able to measure turn performance in a clinical setting would be ideal. So therefore, the purpose of this project was to address these gaps and firstly assess spatial temporal stepping metrics during turning based on the direction of their turn, so either towards the uninvolved or involved limb, and comparing the first and last minute of the 6-minute walk test. And secondly, determine if turn performance was related to dynamic balance performance as assessed by the functional gait assessment. So we conducted a case series involving 8 patients with end-stage hip OA, and on average, they were 65 years of age, had a BMI of 27, mainly males, and they performed the 6-minute walk test and the FGA. And you can see from the pictures here on the right, we placed, in this case, it was XNs, on our participants while they completed the 6-minute walk test, which is a IMU system. So the placement of those, we had one on the sternum, one on the lower back, one on each lateral side of the thighs, one on each tibial tuberosity, and one on each top of the foot. For our first aim, during the turns, we looked at our spatial temporal metrics of step duration, number of steps, turn duration, and maximum turn velocity. And we got these variables from a code that Hope Davis Wilson actually created that's a co-author on this project. And so it's a rather novel code, and we're looking forward to hopefully getting feedback from you all about how to improve this code. And we were comparing these metrics between our participants that self-selected to turn towards the uninvolved and involved limb, comparing the first and last minute of the 6-minute walk test. And for our second aim, we visually inspected scatter plots to see if there were any relationships between these metrics and our FGA scores. And at the bottom of this slide, you can see a depiction of the path that our participants used for completing the 6-minute walk test. So it was a 100-foot path, and our participants had to make a 180-degree turn at the end of each of this path, and they were instructed to complete as many laps as possible during the 6 minutes they were allotted. For our analysis, we looked at the angular velocity of the pelvis and the transverse plane and created a threshold based off the first 10 seconds of data and found the maximums of this signal. And that was in our threshold to detect when a turn was happening. So did the data pass this maximum, and did it pass it for at least half a second? And if so, then we identified that as a turn. So you can see this portion of the data here then would be quantified as a turn. To look at our stepping outcomes, we then overlaid the data with the velocity from our right and left foot. That's what I have pictured here. So the red line resembles the right foot and the blue line resembles the left foot. If we zoom in on the turn a little bit, this dashed line resembles where the actual turn was quantified. And so if we were to, in this example, count steps, the blue, which is the left foot, we have 1, 2, 3 steps that were quantified here. If we did have steps that were cut off by the parameters of our turn, then we did not count those. So this first right step did not count, but we had 1 here, and then the second one, unfortunately, was cut off. So only 1 right foot step and 3 left foot steps in this case. When we look at our comparison between groups, the UL group reflects a person that self-selected to turn away from the involved limb or towards the uninvolved limb. So if someone had right hip osteoarthritis, that meant that they consistently self-selected to turn to the left. If we had that same participant and they were in the IL group or the involved limb group, that meant if they had right hip osteoarthritis, they were consistently turning to the right. So we had an equal split. We had 4 in each group. And you'll notice that the UL group had higher pain levels, 7 out of 10 for both resting and following a 6-minute walk test. So much higher than the IL group. And if we look at the metrics over here on the right, we'll see for the percent change for the UL group, we have quite a decrease in step duration, as well as an increase in the number of steps. And that's quite different than the IL group. As well as the UL group had a slight increase in turn duration and a slight increase in maximum turn velocity. When we look at our scatter plots, what we can see here are comparisons from some of our spatial temporal metrics and the FGA scores. Specifically, you'll see that shorter turn duration during the first and last minute of the 6-minute walk test trended with higher FGA scores. And this was surprising given that only 1 of the 10 FGA items evaluates turning. And additionally, longer 6-minute walk test distance trended with higher FGA scores. These trends suggest that turning performance and 6-minute walk test distance may be related to other domains of balance evaluated by the FGA, such as change in walking speed or tandem walking. So overall, our results suggest that spatial temporal metrics captured by IMUs during the 6-minute walk test may be helpful to identify self-selected turning patterns and may be related to dynamic balance performance and possibly fall risk. Although we're cautionary that we had a small sample size with this data. And if larger studies support these data trends, clinical use of IMUs during the 6-minute walk tests may be helpful for physical therapists and other rehabilitation professionals to identify physical intervention targets such as turning metrics and associated balance performance in hopes of reducing fall risk. Thank you all for your time, and I look forward to answering your questions during the live Q&A session.